The current methods for diagnosing fibromyalgia face several challenges that lead to long delays in the process of formulating an accurate diagnosis. These methods also rely on very subjective reporting from patients and a lack of biomarkers. This makes the process of diagnosing fibromyalgia very inconsistent and prone to misdiagnosis. The current methods, which depend on subjective patient reports with little reliance on biomarkers, lead to variable diagnosis.
Patients likely endure a lengthy process in which doctors must systematically rule out other potential causes of their symptoms. For many patients, this diagnostic journey has taken months to years, during which the patient has to suffer without any effective treatment.
Primary symptoms of fibromyalgia include widespread musculoskeletal pain, severe fatigue, cognitive issues often described as fibrofog, and even other disorders including irritable bowel syndrome, depression, and anxiety. Despite the severity of its symptoms, causes of fibromyalgia remain elusive.
The fibrometer is a diagnostic device curated for the objective and rapid diagnosis of fibromyalgia syndrome. We integrate biosensors to monitor various biomarkers such as heart rate variability, galvanic skin response, and electrical signals to analyze physiological data in ways that traditional diagnostic approaches cannot match. This novel method allows for a significant reduction in diagnosis time so that early intervention and better management can help in curing patients sooner.
The fibrometer GSR biosensor is a small ring-like device housing the motherboard, wiring, and a compact battery. It features a contact pad to measure galvanic skin response, GSR, a basic LED for survey status, and a vibration motor with heating pads programmable via an app for customizable intervals.
The biosensor patch is a sleek, flexible design with miniature circuitry, a vibration motor, and a heating pad inside a polymer silicone rubber frame. It attaches to the skin with a 1.5 by 1.5 inch adhesive base, ensuring easy application and removal. Data is transmitted to a Bluetooth-equipped vest that uploads it to an ML interface, allowing unrestricted movement and everyday functionality.
The HRV biosensor arm patch features a Velcro strap for secure wrist attachment and it houses its circuitry in the center panel. The skin contact sensor is embedded in the fabric over the pulse point, while a cotton cover ensures comfort during sleep. An LED on the front panel reminds users to complete their app survey.
The vest is tank top inspired with centralized micromachinery for compactness, surrounded by padding and flexible cotton. This design lets users wear clothing over the vest for a sleek, discreet appearance. The headband is equipped with 64 electrodes for enhanced EEG imaging, detecting spikes or abnormalities in beta, theta, and delta waves, and covering areas like frontal asymmetry. The headband is lightweight and sleek, made of medical-grade silicone with memory foam and breathable fabrics for comfortable ventilation.
We validated such a model by training on synthetic data created by a generative adversarial network and received accuracy metrics of above 90% in differentiating between controls and fibromyalgia samples. This rivals the current lengthy process and gives us a glimpse of the expected success when applied to a real-world setting. We introduce a deep learning pipeline leveraging biomarkers and PSG feedback for fibromyalgia detection. We integrate UNet, graph and convolutional neural networks, and autoencoders to process sensor data in a way that provides primary care physicians deeper objective insights into. We advance the fibrometer's validation and development by consulting faculty from CHOP's AMPS department. On December 9th, Dr. Sabrina Gamuka provided key insights via Zoom on refining feasibility and addressing critical clinical challenges. We consulted industry experts, including Dr. Nazar Dave, ML PhD at Penn State, who supervises development of smaller-scale pipeline components. Our models surpassed current diagnostic accuracy and achieved over 90% precision in distinguishing controls from FMS datasets.
Fibrometer wirelessly syncs with the cloud-based platform that real-time monitoring and detailed analytics are accessible to the patient's healthcare provider in an effortless manner for continued analysis and future steps. The clinicians will be able to track progress, monitor symptom patterns, and tailor personalized care plans.
The fibrometer is designed for undiagnosed individuals with chronic pain and other symptoms associated with fibromyalgia. Primary care physicians will prescribe the fibrometer, while early collaboration with providers and payers ensures smoother clinical integration and better patient access. Pilot customers, leading fibromyalgia hospitals and clinics will provide feedback and serve as reference sites.
Additionally, fibromyalgia disproportionately affects women, making up 80 to 96% of cases, yet it remains underdiagnosed and often dismissed. Hormonal factors may heighten pain, while societal biases lead to underdiagnosis and neglect, leaving many women without proper care.
The fibrometer offers a non-invasive, faster, and more reliable diagnostic tool to improve the patient experience in clinical decision-making. The fibrometer